There we go. I think we'll kick off. Very warm welcome to you all this evening. The last of our winter webinars, just before you all kick into lambing. Some of you may already be lambing, so if you are, we wish you the very best of luck. It's a gorgeous evening in Aberystwyth tonight, so nice full moon and a rare dry day, so very wet about the place. So for the last instalment of our webinars, we've got Peers Davies, a good friend of ours, our veterinary consultant, and Piers works independently and works in Liverpool Vet School as well. So a great wealth of knowledge on all things to do with sheep health and production. So very, very pleased to have Piers with us this evening. The webinar has been recorded. As always, those of you that have been in before will realize that anybody that's registered for it will be getting it tomorrow. So even if you're on it this evening and hopefully you've got a brew, a cup of tea with you and you're relaxing, having dinner, we can't see you, so you can put your feet up. You're absolutely fine. But you can hear us, hopefully. There is a Q&A button at the bottom of your screen there. You should be able to see it. And if you've got any questions whatsoever as we go through this evening's webinar, then please put them in there. And we will do our very, very best to make sure that we give them to Piers to answer. And Piers will be going through quite a lot of information tonight. We've seen what he's doing, so there's a lot of information to absorb because it's obviously quite an important and complicated area, but we'll try and demystify that if we can. And we'll try and make sense for you all to give you some practical actions. And obviously, the title really is From Our Farm to Yours. So there is an element tonight of us explaining to you what we do within Innovis to try and protect our customer flocks. It's never easy, always a moving feast, as Piers, I'm sure, will tell you. So enough of me going on. We're going to pass over to Piers. And Croeso, Piers, welcome.
Diolch, Dewi. Thanks very much. I'll just share my screen so we can see the presentation. So hopefully everyone can see that that presentation now. So yeah, thanks, Dewi, for introducing us, and thank you for the opportunity to talk to you all about this topic. As Dewi said, this is an incredibly broad topic, really. So just to give you an idea what we're going to be talking about today, so it's really about the infectious diseases in terms of health. And some of those we can prevent, some of those we can mitigate, but can't prevent them entirely. But there's also the element of understanding what the limitations are that we face when we're trying to manage health in a commercial flock. And thinking how to break this up. I mean, there's lots of different ways you can break it up, but the way we decided to do it tonight is according to groups. So we'll think about the parasites, the bacteria, and the viruses, and go through them in order, really. So when we think about parasites, we really think about sort of three main groups, really. So the roundworms, so the causes of scour, really, and there's a group of species within that which we'll consider together. Liver fluke, and then sheep scab. There are obviously others, but they're the most important ones that we've got some time to cover today. And then in terms of the bacteria, going all the way from what we'd call the sort of endemic diseases, the ubiquitous diseases, which are present in pretty much every sheep and every farm. So your Clostridium pasteurella, really good example of that, through your foot rot and cod, which are in the vast majority of flocks. And then maybe a bit more discussion on some of the things which are not so familiar to most people within the industry still. So Yonis in sheep, and a touch on CLA as well. And then in terms of the viruses, we'll talk a bit about Mydevisner and border disease, probably the two most important viral diseases that we're dealing with. We'll touch on OPA and then finish with Bluetongue, particularly because it's probably the most topical of all of these diseases that we're contending with at the moment. So before I sort of delve into the detail, I would like to highlight where you can go and find more information, because we can only touch on these in relatively sparse detail at this stage. But if you want to go and find more information for the parasites, by far the most useful and comprehensive document, which is mostly up to date, is the SCOPS guide. So the full manual is available online, and a wealth of information there, and well referenced and well evidence based. For the bacterial diseases and some of the viruses, what I'd recommend people refer to will be the technical manual for the iceberg diseases that we wrote going back to 2018 now. We wrote that for a project funded by AHDB. So there we're focusing on Johne's, CLA, Mydevisner, board disease, and OPA. So going all the way through from how you diagnose it, how you can control it, how you can prevent it, and what the potential production impact is. So that's a good reference guide for those mixture of viruses and bacteria. And then for lameness, to delve into lameness in a bit more detail, the 5-point plan and the aids provided by HDB, again on their website, are really good resources for both foot rot and cod. So they're the place to refer to for more information, or by all means contact me by email, and we can go through anything in more detail if you've got more specific questions. Okay, so time is pressing, so we'll kind of delve straight in. So I thought we'd start with the parasites, really, because they're the most ubiquitous, probably the disease that we're probably most familiar with. We have to all contend with them. We know anthelmintic resistance is around. Pretty much every farm has a level of anthelmintic resistance, and it's something that we can't escape from. So with Innovis farms all have to contend with anthelmintic resistance, much in the same way that all of our customers do. And when we're thinking about specifically the element of how do we prevent anthelmintic resistance moving from farm to farm with rams, or the same argument equally applies to replacement ewes, then we're thinking about quarantine treatments. Now, we're all pretty familiar with, particularly with Zolvix, to a lesser extent, people familiar with StarTect. They both fulfill the same role, really. These are products which have not been used to the same degree in the industry as the benzimidazoles and the levamisols and the other macrolide lactomes. So there's a better resistance profile to these than most other chemicals. Although StarTect actually is a combination of two products, one of which actually is a clear drench, but the combination has increased efficacy, increased sort of killing power. So what we're using these products for is as a clean out drench. So administering them to rams in the case of Innovis, at the point of sale before they're loaded, with then the follow-up guidelines that these animals are retained off pasture for at least 24 hours, ideally 48 hours, so they can pass out those worms in their system and give you the best opportunity of avoiding any carryover from one farm to another. Because flocks and sites where Innovis rams are reared will have their own particular resistance profile, which will be different, not necessarily better or worse than what you're dealing with in your own flock. But what you're trying to avoid is the import of any new resistance profiles, any new resistance genes in those worms, which could then contaminate your farm. So the advice that we're following is really based on the SCOPS guidelines, which you can read in much more detail from their website. And it's probably the bit we're kind of most familiar with. You can always do it better. So ideally, you would use both StarTect and Zolvix together. There's obviously barriers to doing that, not least the fact that, as with lots of the other vaccines, antibiotics, and wormers, we've had really intermittent supply of one or both of these at different stages over the years. But at least giving one of these treatments before movement is really important. So if we move on then to liver fluke.
Sorry, Piers, can I just ask before we go on to liver fluke, is there any resistance build up to some of these in the industry, or are they 100% kill still for StarTect and Zolvix?
Yeah, it's a very good point. No, there's definitely resistance to both of those out there in the wider industry, both in the UK and abroad. So we found resistance to monopantol, to the active ingredient in Zolvix, in the Netherlands first, going back 10, 12 years. And in a sense, there's nothing different about those products other than they're newer. So the more you use them, every time you use them, your exposing the parasite population to a selection pressure. So resistance will develop absolutely inevitably to those products as well. All we can expect is that we can slow down the rate of resistance development to any of the products by rotating them around and using these newer products with a better kill rate to try and avoid carrying over worms which might have resistance to the other groups onto a new farm. But they're not a silver bullet. They're not a panacea. They are really just a newer product, but not intrinsically any better. So yeah, I hope that's clear. But again, if there's anyone's got any more questions or wants any more clarification, then by all means, let's talk about it in the Q&A later, or you could email me later again, and we can go through it. But then moving on to liver fluke. So liver fluke got a slightly different issue to deal with, mainly because of the length of time that the parasite takes to develop and the fact it's quite seasonal. So we don't have quite the same simplicity of saying, okay, we can move an animal and we can treat it on movement and have the best opportunity to prevent liver fluke from moving. Because if an animal has been infected, say the day before it moves, then it's going to be at a stage where it'll carry liver fluke, but not be susceptible to any of the treatments, really, until it gets to at least 2 weeks post-infection. So this is the first of the diseases where we really start thinking about the length of the quarantine period as being critical. So the standard advice that is given with Innovis rams, and the standard advice I give to all of the sheep farms that I deal with on a consultancy basis is you calibrate the length of your quarantine period according to the diseases you're trying to keep out. So in the case of fluke, what we're dealing with is we bring an animal on. Realistically, we keep it in quarantine on either housed, ideally, or at least on a very low fluke risk pasture. So that means a dry pasture where there isn't any habitat for the snail intermediate host. And we treat that animal about 2 weeks after moving on into that quarantine area with a triclobendazole. And that's the one at the bottom here on this table. And after about 2 weeks, you're going to get a very high likelihood of killing all of those flukes. But we do see some triclobendazole resistance. So to catch any fluke that may have been resistant to triclobendazole and avoided that treatment, we actually have a quarantine period for fluke, which runs to 42 days, and you treat them at that point with a closantel. And the point of doing that is to allow any fluke who have been ingested and matured to that point then to be killed by that second treatment. So this is probably where the term belt and braces approach really applies. So you've got triclobendazole and closantel as your kind of belt and brace approach to minimize the chance of bringing fluke in to that farm, and also for the protection of that individual animal. I mean, having said that, an awful lot of the flocks that rams go to won't have liver fluke. A lot of the flocks where rams are produced won't have any liver fluke either. So again, it's a kind of belt and braces approach by treating those individuals just in case. But it's a very useful thing to do.
So Piers, can you just run through the belt and braces is what? Sorry, triclobendazole and the closantel.
And the closantel, but not at the same time. So we have this lag in time to allow any liver fluke that might have escaped that triclobendazole to mature to the age at which it'll then be susceptible to the closantel.
Okay.
And that's hopefully what this sort of table shows. You've got the different products. It's a bit of an old table now because we don't have nitroxanil anymore, but we've got the two at the top, which are your adulticides. These only kill adult liver fluke. So we're talking 10, 11, 12 weeks post-infection, all the way down to your triclobendazole, which kills the immature flukes and the adults and the developing juveniles. So your belt and braces is your triclobendazole. That's that's the absolute bare minimum. And then, the recommendation that we'd say is then go in again with a closantel later on in order to catch any which might potentially have escaped. Now, the situation is moving on, and with liver fluke, what's happened, what's sort of come onto the market in the last 12 months is a means of actually testing for liver fluke with a pen-side test. So this was a pen-side test developed by colleagues of mine at Liverpool, and this allows you with ear prick blood samples to test for liver fluke exposure. So we commonly use this actually in groups of growing lambs, because we know that if they test positive, they've been exposed in the last few weeks, rather than if we test adult ewes, then they can have antibodies hanging over from the previous year. But it gives you another way of trying to understand your level of risk and honing your decisions. So this is available. Actually, I think Norbrook are running a promotional scheme at the moment with a certain number of free tests available. So if you go on their website, you might be able to get some free tests that you can use, or you can use with your vet.
And Piers, within a group of sheep, how many would you need to test using this as a sample to get a sort of a sensible handle on it?
Well, yeah, so we'll talk a lot more about sample sizes a bit later on, but for these 10 animals is what we're looking at. There's always a temptation of, you've got this one animal that looks a little bit dodgy, let's test that one specifically. There's a bit of a downside to doing that, is that the test is really designed to be looking at a group of animals, and if any of them test positive, then you know that there's exposure there. But I won't delve too much into the intricacies of the test, because we could easily spend an hour just talking about how to use this and when to use it. But it is something that I would urge you, because fluke is so endemic in so many flocks, especially in the West. Then this would be something to discuss with your own vet, to decide on, particularly when you do your treatments. If you're a flock which knows you've got fluke and you treat fluke every year, this can really help you time your treatments, so you're not wasting triclobendazole treatments going in too early, and you're not attributing poor performance to other causes when it actually is a liver fluke case, and going in too late as a result. So it's something definitely to have a look at. Okay, so moving on. So this is the last of the parasites, but one which is unfortunately becoming a lot more common. So sheep scab has expanded dramatically in the last 10 years, particularly in hill flocks, and we've got an issue. On top of the spread, we've also got an issue with an increased difficulty in actually treating it, because after having a few decades of very effective treatment of scab with moxidectin particularly, we've now got very widespread moxidectin resistance and treatment failure. So we've got to be quite strategic about this now. We've been in a situation where the industry has been advised to move towards dipping rather than moxidectin treatment as the sort of the first line for several years now. But that comes with its own downsides, quite important downsides, really. Obviously, the toxic risk for people, but also the fact that the dip it can be a way of spreading infection as well, because whilst it's very good at killing parasites and rather toxic to humans as well, it doesn't have any antibacterial properties at all, and no antiviral properties. So it can be a good way of spreading infection as well. So you're trading those risks off against the need to have an effective treatment. And when we look at the guidelines, so again, referring back to the SCOPS guidelines, we have this sort of slightly outdated advice in some respects, where we have sort of OP dip and moxidectin injection almost on a par, whereas we know that moxidectin injections are becoming less and less effective in many farms. So where we can, we really want to try and keep it out, obviously, if we can. And we can use the antibody test, which has been developed, again, relatively recently. So again, in the last 10 years, we've now got a very effective antibody test, which is far, far more effective at testing for exposure within a group than simply looking for clinical signs, looking for itching, and taking skin scrapes to try and find the mites, which has always been a very low sensitivity, rather hit and miss approach until the cases get really advanced. So, I mean, we're no different to any other flocks within the industry. We're at risk of scab, and we have to be very, very vigilant for any signs of exposure. And when there are signs of exposure, typically what we'll look at is testing for any antibodies, and then treat in response to treating the entire group if there are any exposures. Mercifully, it's been very, very rare, but you can imagine the events which are risky. So particularly if you went and bought rams through sale marts, anything where you've got animals from lots of different sources moving through the same penning, then it's a real risk. And that's been a justification in the past for dipping animals before sales if they're going to go through communal marts, which is a real benefit of actually trying to have sales which are all from one source, so on-farm sales or selection days where we don't have that risk of cross-contamination. But it is an ever-present risk, and unfortunately something which is going to be an increasing threat to the industry as we go forward.
Piers, sorry, Piers, in terms of the test, because I know we regularly do this to look at exposure in ram growers of ours. In terms of the test, how wide is the window that you're actually getting a reading on? In terms of, is it months, weeks? What does it give you really?
Yeah, so it's pretty fast to come up, as in, so after exposure, you're talking about roughly 2 weeks after exposure, we're picking up the vast majority of exposed animals. The antibodies stick around for a very long time. So a positive test can be indicative of an exposure, not necessarily a current infection, because you can find a group who've been exposed, we treat them, and you go back and test them for antibodies months later, and they'll still be positive. And this is where we start looking at what we call the antibody titer, so the level of antibodies. So another way that you can try and understand whether the reading that you're seeing represents real infection or not is you take 2 samples, 2-3 weeks apart, and you're looking for an increase in the titer. If the titer is going up, that means you're getting more antibodies produced, and that's happening in response to an active infection. And conversely, if you're getting a drop in the antibody levels, that means that fewer antibodies are circulating because they're just being metabolized and processed as they age and break down, and they're not being replaced because they're not needed. So this is a waning response, indicating that the animal isn't currently infected. So the interpretation of the test needs to be done with your vet to understand what's going on, and also the interpretation of whether a positive test result actually is positive, because this test, like all of the other tests we use, have a proportion of false positives and a proportion of false negatives. So animals which will appear positive to the test but actually don't have it. Now, it's a pretty good test. It'll pick out about 98% of the really infected ones, but it will also misdiagnose 3.5% of the ones who don't have it. So when you test for it, it's very much a case of interpreting how many positives you get as whether that really means that the group is infected. And that might become a bit clearer when we deal with some of the later slides, when we talk about this in the context of Mydevisna. But it's quite a complicated issue. And again, we can go through it in more detail in the Q&A or at a later date if people are interested. But moving on to the bacteria. So again, kind of starting with the most ubiquitous bacteria, the obvious one to start with are your Clostridia and Pasteurella. Every animal's got it. They're carrying it in the back of their throat. They're carrying it in their tissues. So we protect stock in much the same way as most people do. So Heptavac is used across all of the flocks producing rams, and they're then boosted as lambs. Rapidly growing lambs are at more risk, so it's even more of a benefit than you might think for a normal flock. You're then taking rams through this growth phase. Rams pretty much always are at more risk than ewes, just because they're partitioning so much energy and protein into growth and into muscle, and less goes towards their immune system. So we always find that rams are more delicate, no matter what the breed and no matter what the production system, than the ewes on an equivalent system, which means that we actually often boost the animal's pasturella protection with additional booster shots during that production phase. And we do it particularly with the pasturella component, because that's the bit of the heptavac which lasts the shortest period of time. You're really only talking about, in some cases, a matter of weeks of protection, rather than the 12 months that we would typically expect for the clostridial components. So it's a pretty effective way of managing that risk. And certainly for a lot of the store lamb buyers that I also deal with, on a consultancy basis, they also use this approach, because you've got stressful events of transport, mixing, that can precipitate a pasturella outbreak. So strategic extra boosting can be very effective. Okay, so moving on again. So the next kind of, most ubiquitous of the problems, particularly foot rot, and depressingly cod as well. So from the data we've got, 90 to 98% of flocks have foot rot. The ones who are foot rot free are generally small flocks, where it's much easier to eradicate it. Very hard to eradicate it from larger flocks. Cod, unfortunately, in the last 25, 26 years since it was first identified, has spread and spread and spread. And so during my career, it's gone from about 50% of flocks infected to over 70%, and that proportion of flocks infected is only going to increase. Eradicating cod is exceptionally difficult. But what we can do is not a hopeless situation. We can stamp down very hard on it and depress the levels to very low levels. And the approach we take is, across the industry, is a sort of multi-pronged approach. So there's foot bathing, there's vaccination, there's prompt treatment, and that's sort of summarized within the 5-point plan. So there's the industry initiative, which is summarized to the 5-point plan. And it really hinges on trying to reduce the challenge, reduce the pressure, the infectious pressure on those animals. And that means reducing the amount of bacteria in the environment through treating animals as soon as possible. That's probably the most important single one, because if you treat them early, then that'll reduce the number of bacteria. So think about it as though a sheep is depositing 1,000 bacteria a day on the pasture. If you wait a week, 2 weeks before you treat it, then you're talking of 7,000, 10,000, 14,000 bacteria on that pasture. If you treat them within a couple of days of seeing them, you've already reduced the number of bacteria that are available to infect the next sheep. So that's probably the single most powerful part of it. The other ways you can do it, which become progressively more difficult, are things like segregation. So when you have a lame sheep, you treat it, you segregate it, you again avoid that transmission. And then some things which are, in a sense, easier and more important. So not all sheep are going to shed an equal amount of bacteria onto the pasture. So culling very hard repeat offenders. So recording who gets treated. The second time they need a treatment, then they're on the list to be removed. And this real sort of zero tolerance approach is incredibly effective. You're improving the genetics of the flock in terms of their resilience to the presence of the bacteria. You're also removing those hyper shedders, the ones who shed a lot of bacteria multiple times. You can also increase the resilience of the flock by improving their immunity. And this is where footvax comes in. Now, footvax was never developed for cod specifically, but it has a benefit knock-on effect on cod by improving the resilience to foot rot. So you see a benefit in terms of cod cases when footvax is being used. It's not an enormous effect, and it's quite a variable effect between farms. Some farms see a much greater benefit than others. So it's not a panacea. It's not something that you can do and ignore the rest of it. It would be an added extra once you've done these core basic things, would be the way that I would describe it. In terms of the foot bathing again is something really, really interesting and important when we think about this quarantining of rams. Obviously, we go through rams very carefully, and anything with any signs of any lameness, wouldn't leave. Because that's not fit. But we'd recommend that in that quarantine period, new rams go onto farm, because they can still carry bacteria on their feet no matter what a ram looks like. You want to try and kill those bacteria off. So foot bathing them several times during that quarantine period can help reduce that surface level of contamination. And if you can kill them on the surface, they're not going to invade then deeper into the tissues. But again, foot bathing can only deal with the surface. So you need to have animals who have good resilience, a good immunity beforehand in order for that to really work. But it
Piers,
is, again,
yeah. In terms of, things like cod and even foot rot, certainly cod, when it's in pastures and stuff, is there a specific time frame before you deem pastures to be clean, or is that it? If you've got it, it's on the ground effectively.
Yeah, well, that's a really good point, actually. And there's two parts to that answer. There's an answer for foot rot and there's an answer for cod. The answer for foot rot used to be 3 weeks. We didn't think it would last more than 3 weeks in pasture. And now that's probably an oversimplification, and an oversimplification based on our ability to grow it in the lab. So what you do is you take pasture samples and you try and grow it in the lab, grow the bacteria in the lab from that pasture sample. And if you can't grow it, then you'd come to the conclusion that it's not there. Now, the limiting factor with that is how good are our lab procedures at replicating what a sheep's foot is like as a growth environment. And the way we do that is actually we take sheep feet and we grind them up into powder and we add that to the agar that we try and grow the bacteria on, but it's not perfect. So probably they can actually last a little bit longer than 3 weeks, but not much longer in all likelihood. Cod, however, we've got good evidence that it'll last much, much longer, and we don't really have any idea how long. We've got evidence that it'll be spread in the pasture and on equipment as well. So on hoof shears, if you are trimming, which is not generally needed, although in some instances it's useful to establish what's going on with the lame foot, but you can spread it on equipment, on fingers, very effectively, and it's going to be resident in the pasture for a long time. We've also had instances, on several flocks that I've dealt with for many years, where you've had animals which have apparently incubated it for a very long period of time. So it's that all of those factors make cod much more difficult to deal with than foot rot. And again, we could have easily a whole hour on cod control and what we're trying to do to improve that, because again, in Liverpool, actually, it's another area that some other colleagues of mine really focus on. Their research is really focused on cod and digital dermatitis in cattle, which are two incredibly closely related bacteria.
How big is that risk, Piers? Because obviously there's a lot of sheep out on tack currently on dairy ground that have just come back home.
Yeah, so the risk of cross-contamination is an interesting one. So it doesn't seem to be that great from cows to sheep. We don't seem to see a big correlation between exposure to dairy pasture and cod cases then in the sheep. We don't actually know that much about it going the other way. Probably not that great either, but a large part of that is actually how that dairy pasture is managed. A lot of people sending sheep on tack are sending sheep on tack onto silage ground, which would then obviously not present a risk to dairy herds in the way that, if they were on the less likely event going on to ground which would then be grazed. So we don't really know about the risk, but certainly in the studies we have done, it doesn't seem to be a massive risk factor. That may be down to the strains involved. So they're closely related bacteria, but not close enough to cause a lot of jumping between species. Unlike the next thing we're going on to. So the next thing we're going on to is Johne's. Now, any of you who have run cattle are probably much more familiar with Johne's as a cattle disease. And this is something which we have got more evidence actually does jump from cattle to sheep and vice versa. But more importantly, we have been massively underestimating the proportion of the UK industry which is actually infected. So I'm going to got a few slides now and a few references to papers that, this paper here is something we only published a couple of weeks ago, and it's open access. So anyone who's interested, you can find this online and read all about it. It's the culmination of about 8 years worth of research work that we've been doing both in the UK and in New Zealand to establish how common Johne's is in sheep and what the production impact of Johne's is under our grazing systems in both countries. So our first estimates, to be honest, came as a massive shock to us back in 2018, when at that point we found 64% of flocks were infected. So of all of those iceberg diseases, by far the most important and the most prevalent of those icebergs by an awful long way. The next most prevalent one was border disease at about 35% of flocks. But since then, as we've done more studies, we've actually increased those estimates. Now we think in the UK, it's probably around 80% of flocks are infected with Johne's, and the vast majority of those don't know they're infected. We did a very similar study in New Zealand with colleagues at Massey University, and they found even more flocks infected. And the reason that we don't see the same level of awareness, we think, amongst the sheep farming community and amongst sheep vets is because it looks very different to what you see in cattle. So a lot of farmers and vets' perceptions of what Johne's looks like is the picture at the top. So this emaciated, scouring sheep. And whilst some sheep will look like that with Johne's, the vast majority have a much more insidious disease with no scouring and quite a slow loss of weight, which means actually they present as something quite different. So to try and explain this, we've got a bit of a sort of animation to explain it. So if we start off with our young lambs, Johne's infects calves and lambs when they're very young. When they're infected, it's going to multiply up, and it's going to take 2 to 4 years to multiply up. And then you're going to get 3 different potential outcomes. So your severe disease outcome, which is pretty rare, your totally resistant or resilient animal, which actually can clear the infection, which is a really important genetic type of animal that can cope with that. And that's what we want to breed from, really. But then you've got this yellow group, this much more important group, these animals who are what we'd call subclinically infected. And they are the ones who probably cause us the most damage. And I'll just explain how we think that happens and what evidence we've got to support it. But this red group and this yellow group shed MAP bacteria. So this is Mycobacterium paratuberculosis. They shed this bacteria into the environment, and that's what goes back and infects the lambs. So, completing the infectious cycle. But these subclinically infected animals divert energy into this immune response, into what we call the cell-mediated immune response. Now, that takes a lot of energy and a lot of protein. And what they're doing is they're trying to fight off the infection within the gut lining. And that causes a really aggressive inflammatory reaction within the gut. And this is what looks very similar to Crohn's disease in people, where the same bacteria has been implicated as being potentially involved as well. So you get basically like irritable bowel syndrome in these sheep. And that inflamed gut can't absorb nutrients as efficiently. And it's also leaky. So now we're not absorbing nutrients, we're leaking nutrients out of the bloodstream into the gut. And that leads to a slow chronic malnutrition. And that malnutrition takes a toll on that animal. And that animal then has to start sacrificing other bits of its biology in order to cope with that infection. And the first thing that animals will downregulate in order to cope with a chronic infection like that is its reproductive system, which means you're more likely to find empty ewes. So this brought us to the idea that actually, well, if this is true, are we seeing higher levels of Johne's bacteria in empty ewes in a flock after scanning compared to the pregnant ewes. And if that happens, what's going to be the impact on the flock? So we did a number of studies going back through. It was through the early years of COVID. We were doing a lot of this work, mostly in flocks in Wales. And what we found is this is exactly what's happening. When we tested the feces of empty ewes and pregnant ewes, we found much higher levels of MAP bacteria in the empty ewes. And we then saw this correlation with what happens within those flocks. So those flocks typically are culling at a higher rate. They're culling younger animals and then being forced to replace more animals. So this is what this graph is showing here. We've got the uninfected flocks are in blue. And what you can see here is the proportion of the flock in each age group. So on the left-hand side, you've got 1-year-old sheep, then 2-year-old sheep, 3-year-old sheep. So in the uninfected flocks, you're running at just under sort of 25% of the flock is 1-year-old. And by the time you get to 5 years old, you've still got, 12, 13% of the flock at 5 years old there. But if you look at the infected flocks, by the time the animals get to 3 and 4, they're dropping out at a very rapid rate. So you're getting very few animals surviving to 4 and 5, which means you're forced to keep more replacements. So the real economic impact of Johne's in a lot of these flocks are not these scouring ewes, are not sheep you ever recognise, but they're the fact that you're forced to keep more and more replacements, and that is a hidden drain on the enterprise, which it all sounds incredibly depressing. But the silver lining to it is this is actually a disease which is in some respects easier to manage and control than it is in cattle, because we've had a vaccine for Johne's developed originally in Spain and then developed further and researched very heavily in Australia, which is actually very effective. And it's a vaccine that we give relatively early in the lamb's life. So we typically select replacements about 4 months of age, and then we give the vaccine. And we definitely try to get it before they're 6 months of age, in order that the animals are protected then for the rest of their life with no need for additional boosters. And the work from Australia shows that this is very effective at actually mitigating those insidious effects of the disease. So, it's such a ubiquitous disease. The vast majority of farms are infected. So we took the decision many years ago, with Innovis, that, all rams are given Goudaire, given the vaccine, when they're selected to about 4 months of age, with the simple objective of trying to make sure that if any of them have come from farms where there is Johne's, or come from flocks where there is Johne's, that they're going to be protected and that they're going to then be able to have as long a productive life as possible. And I think as more and more people become aware of the prevalence of the disease, I think this is going to move from being a very under-recognised disease to being something that people, especially as flocks become more and more proficient at trying to manage these sort of marginal gains and manage metrics such as replacement rate, the use of the vaccine, the use of this as a preventative measure, both here and in New Zealand, is going to increase further and further. So this is probably some of the most sort of up-to-date research that we'll touch on today. And if anyone's interested in it, this is probably one of the major areas that I'm involved in as an academic. So very happy to talk through this in more detail.
Piers, in terms of the cost effectiveness of the vaccine, I'm really thinking to one-off vaccine for lifetime.
Yeah, one-off vaccine for lifetime. So, very, very cost effective, really. You don't need to squeeze very many more productive years out of an animal, or out of a few animals within a group of vaccinated animals, to pay for it. So in terms of payback per year of life, it would be, very competitive against vaccines that we're very familiar with, like our clostridial vaccines, which we have to give every year, which are a bit cheaper per dose, but have to be given every year, and arguably probably more cost effective than some of the the similar sort of long duration vaccines like Toxovax, so arguably kind of more cost effective than that. And we're working on some economic analyses at the moment across lots of those diseases, actually, so we can, using the same methodology, compare actually which are the more effective vaccination control measures to use against this range of endemic diseases that we're dealing with, which is something that's been lacking in the industry, this kind of fair equivalent analysis of economic value for these different intervention measures. So that's something that I've currently got a PhD student working on, kind of following on from this Yoni's work, and we'll hopefully have some interesting papers out on that, in the relatively near future.
And Piers, could you just explain to us, because obviously we get a lot of our customers that will have a vet out, rightly so, just to look at their rams and MOT their rams, and quite often they'll do a blood test for Yoni's and they may get a positive because of the vaccine. How does that sort of disentangle itself?
Yeah, absolutely. So, I mean, in common with almost all vaccines, you will get an antibody response in an animal which has been vaccinated. There's a very small number of cattle vaccines where you can, with a lab test, differentiate vaccine antibodies from real antibodies to the infection, to the disease. The vast majority of diseases that we deal with, and all of the sheep diseases, are not like that. So you can't tell for sure whether they're antibodies from the vaccine or from the wild infection, except by the level of the antibodies and what the animal looks like. So the thing with Yoni's is that the antibodies to a real infection only rise right at the very end when the animal is really very severely affected. So it's what we would call a diagnostic test. It's not a screening test. It's quite useful for diagnosing Yoni's in an animal showing clinical signs, and utterly hopeless at screening animals who look normal. If you want to screen animals who look normal, we use a PCR test on the feces, because they will have bacteria shed in their muck much, much earlier in the course of infection, when they still look normal. And it's we've used both of these in the course of the research, and all of the useful data we can generate is from PCR, from feces. So that's the appropriate test. So I think when vets are out in practice and they're thinking about sort of quarantine screening of animals, it's really important that they're using the appropriate test for those animals. And there is too much confusion out there in the industry about what is an appropriate screening test and what is an appropriate diagnostic test, not just for Yoni's, but for an awful lot of diseases. And you really have to be quite careful with what test you pick for what purpose. So that's the message that goes back. Now, with all rams that Innovis sells, including the ram that I bought myself from Innovis last year, what we get is, as buyers, we get a record of everything that the ram has had, and the Goudet vaccine is listed there along with the Heptavax, along with the Bluetongue vaccines. So they're listed there, and what can be very helpful is if buyers show that document to the vet before the vet takes blood samples, because then the vet should realise, oh, this animal's been vaccinated with Goudet. Well, there's no point in taking an antibody test. That's not going to tell me anything. If I want to, I can take a muck sample, rather than paying money for a test which is guaranteed to show an antibody titer because it's been vaccinated. So that document that goes with every ram is really, really useful. I'll keep hold of it and show that to the vet if you're going to do any ram MOTs. But we'll come back to some of the testing intricacies and how we can use it better a little bit later on. Just on to kind of end the bacteria section before we delve into the viruses. So a little bit of a note on CLA. So we're going from Yoni's, which I would say is probably the most important and the most interesting of these iceberg diseases, possibly.
Piers, I've just got one question, sorry, on Yoni's in the Q&A, which I thought we better ask now since it's relevant. Somebody's asking, if replacements are vaccinated against Yoni's for enough years to cover the flock, would it be possible to stop vaccinating, or does it stain the ground on the farm? So in other words, if you're in a vaccinating program and you vaccinated for, I don't know, 5, 6, 7 years, will the contamination, if you like, reduced, that you can stop vaccinating or not?
Yeah, that's a fantastic question. That's a fantastic question, and it's a really important one to differentiate between different diseases where the answer is very different. So if we were talking about enzootic abortion, for example, the answer to that question would be yes, you can stop vaccinating. You go over that generational cycle of the flock, typically vaccinating, we would say 6 or 7 years to properly cover that generational cycle. And you can, in many cases, stop vaccinating and it won't have survived in the environment. That's not true for Yonis. So Yonis is unbelievably stable. So eradicating Yonis is not realistically possible. So unfortunately, no. What you'll do by vaccinating for many successive years is you will reduce the proportion of animals within the flock who are infected. You'll reduce that down to a very, very small number. But eradication is not possible. If you stop vaccinating, what would happen is that, again, slowly over time, that would build up again, because you're going to get infection from the environment of relatively small number of animals in the first year, but they are then going to be hidden, unseen, and they will then rapidly recontaminate the pasture. And in subsequent years, then the level builds up very quickly. The best natural kind of laboratory to prove this actually was in Iceland, where Iceland managed to introduce by accident from imported rams OPA, mydavisna, and Yonis all at the same time, and very effectively managed to control very aggressively, the first two, and not at all with Yonis because of its ability to survive in the environment. So unfortunately, it's a very good question, but unfortunately, it is something you're managing for the long term. Any other questions, along that vein, we can definitely come back to that at the end as well. But we'll move on to CLA for the time being. So CLA, it's a very ugly disease. It's a very obvious disease compared to the others that we're talking about. And it is important, it's very important for the terminal sire breeds historically, because of course you can't sell rams when they've got these lesions on them, and you wouldn't want to. So for a long time, a lot of flocks would vaccinate with the imported Australian Glanvac vaccine. But for me, it's actually not as interesting a disease, simply because although it looks very ugly, we don't have a lot of evidence about how important it is as a production limiting disease. So we don't have a lot of evidence that it causes reduction in milk yield and therefore growth rate or fertility or longevity. There's a little bit of evidence from Australia that it reduces fleece quality, and clearly fleece is quite a good indicator of overall metabolic health. But unlike the situation with Yonis, we don't have really good hard data to actually quantify how important it actually is. So from our limited information, I'd probably say it's less important as a disease than the others. But it's still important to keep an eye out for it. We used to have a very cost-effective blood test for it. Not the best blood test in the world, not as sensitive as we would like. So we would have a follow-up confirmatory test. Now, some years ago, that went off the market, and none of the labs were providing it. A version of it has come back now, but far more expensive, to the point where it's not really very viable to use as a screening test at the moment. So what we can do is screen for them by checking every animal for the presence of lumps. And where you find any lumps, which might be something totally innocuous, might be something like a salivary gland abscess or something totally unrelated, but in a similar part of the head and neck, then those animals can be sampled strategically. So we can either take a sample from that lump and culture it for the presence of the bacteria, or bleed those animals and sample those for antibodies in a targeted way. So that's a kind of a balanced approach that a lot of breeding flocks, cost a lot of breeds are taking to try and manage the presence of CLA. But compared to some of the others, I'm not quite as worried about that as I am about Yonis or what we're going on to next, which is Mydevisna. So, Mydevisna is something, again, we're very aware of in the industry because of the accreditation scheme largely. But just to kind of reiterate what we know it does, it causes quite an interesting characteristic type of pneumonia, which causes swelling of the lungs. So in this rather gruesome photo from one of my postmortems, you've got a set of ostensibly relatively normal lungs on the left and Mydevisna infected lungs on the right, particularly the left hand side of those lungs on the right. Very enlarged, kind of pale, rubbery. That inflammation makes it much harder for those animals actually to breathe properly, and they're less metabolically efficient. That leads on to reduction in milk yield. So we showed a couple of years ago in a paper from a dairy flock that I work with, a 9% reduction in the milk yield from those ewes, and subsequent studies have shown then reduction in growth rate in lambs, as you would expect when you've got lower milk yield. The problem we have with Mydevisna is it works its way through the flock, it builds up in the flock to the point where you'll get 30, 40, 50, 60% of the flock infected, much like Yonis. And that means that you can have a huge drag on the performance of the flock, particularly where you're getting flocks where there's a lot of opportunities for transmission. So some of the interesting research recently is actually looking at the ways of controlling Mydevisna through either test and cull or by managing them to reduce the opportunities for transmission. If you're housing them in a shed for a long period of time, that's the perfect environment for them to spread. Outside on very extensive systems, much harder for it to spread. And that has to be our emphasis because we have no vaccine available and no effective ways of providing additional immunity. We can test for it, but not prevent it with vaccination. So if we look at the kind of the national picture, I mean, this is a map that you might have seen if you've seen any sort of Mydevisna presentations in the past. This is from the APHA. It maps out basically sort of hotspots of Mydevisna prevalence at the flock level. So the black areas are where you've got between sort of 6 and 15% of flocks are infected. This is a bit old now. This is going back 15 years. The more recent data we've got indicates that this situation is now much worse. And we've got a far higher level of Mydevisna across the country. Now, that is in spite of, I think, what has been an incredibly successful and an incredibly diligently operated accreditation scheme. So I think SAC, SRUC, as they are now, have done a hugely valuable job in the industry of running the accreditation scheme, principally for those very connected flocks. And that has slowed down the progress of Mydevisna across the country. But it probably never had the realistic expectation of being able to halt it or get rid of it. That was never really going to be feasible. But it certainly delayed it by a long way. But now we're at the point where we have so many flocks infected that you're going to get infection between neighbours as well as with purchased animals. So it's going to be a problem that more and more of us are dealing with and looking for different ways to control it. Now, obviously, the accreditation scheme also has the disadvantage that, to comply with the rules, you do have to have a very high level of biosecurity with double fencing, and that makes it very difficult for larger flocks to comply with it just because of the logistics involved. That's why the monitoring can be quite a useful approach. The downside of the accreditation scheme as well is with a testing scheme, which is every 2 or 3 years, you've got the potential risk of, if infection does get into the flock, you've got a long window before you'll realize it's there. So an alternative approach that you can take is actually annual Mydevisna monitoring. And that's what we do with Innovis, and that's what some other breed societies are doing and breeding groups are doing. So annual monitoring of stock without necessarily the same really rigid other associated rules. But the annual nature of it means that you can get on top of problems if they do arise much more quickly. But an interesting element then we come on to is, well, if we're testing, how do we know how many to test in order to get the answer that we need. And this is where, just very briefly, I do want to sort of just briefly describe what we have to think about and what you and what your vet needs to think about if you're thinking of testing your own flock for mydevisna or any of the other diseases. So we've got obviously the size of your flock and the sample of animals that you can take. They're things under your control. They're things that you know. You've also got a couple of things which are intrinsic to the test. So how accurate the test is. And that means how accurate the test is at finding the disease, but also how many false positives, false alarms it generates. And this is what the specificity and the sensitivity of the test is. The other things which will influence your results are how much of the disease there is in the flock to find, because if you've got one single animal in the flock, clearly you've got the potential of missing it unless you test every animal in the flock. If you've got 10% of the flock infected, you only need to find one of those 10% in order to detect it as being present in the flock as a whole. And the final part is, how confident do you want to be of finding it? So if we take the mydevisna accreditation scheme as an example, they've got, any of you who might be involved in the accreditation scheme or aware of it, you'll know that you've got this sliding scale of animals that need to be tested, number of animals need to be tested according to the size of your flock. And what you'll notice is that it's not a linear relationship. So if you've got a small flock, you have to test a very high proportion of those animals in order to get the same level of confidence of finding it if it's there. If you're a very large flock, it gets to a point where you don't need to test any more animals. So you get to 150 animals, you don't need to ever test any more than that, even if you had 2,000 or 3,000 ewes in your flock. And this comes down to the statistics of how we can predict the number of positives that would be within that sample. We're not trying to find everyone, we're just trying to find any real positives to prove that it's there. The downside of this is that you've got the possibility of finding false positives as well. And this is where you really do need to have a very clear discussion with your vet and with the lab as to how to interpret the results, because those false positives can cause an awful lot of heartache. And when we find that, when we do our monitoring, annually every year with all of the Innovis flocks, if we find positives, we'll double test them. So to see if they come back positive on a subsequent test. False positives often don't. They'll test clear the next time. And if they come back positive multiple times, they go for post-mortem. And that post-mortem then, again, clarifies whether it is mydevisna or isn't. And if you're testing several thousand sheep, as happens with Innovis every year, inevitably you find false positives, and they need to be stamped on and ruled out before we go to the next stage. When we find true positives, then we need to deal with those, and we need to go down the test and cull route to make sure that we remove it entirely. And that's been the traditional approach for the accreditation scheme as well. It isn't the only approach in the industry, though. So if you're running very extensive flocks, taking a conservative approach is also possible. And there's more and more data that actually suggests if you're never housing sheep and you're running, extensive low stocking density operations, there's some indication from some of the modelling conducted by the Mordun Institute that actually mydevisna can't survive within a flock managed in that way, and it'll die out of its own accord. So this is an area which really deserves a lot more research, a lot more investment, because we need to understand more cost-effective ways of trying to manage what is becoming a more prevalent disease. The diagram I've got here on this screen is actually taken from that iceberg diseases manual that I mentioned on the HDB website. And that gives you, not just for mydevisna, but for all the diseases, quite a clear breakdown of different ways in which you can try and manage these diseases, by eradication, by conservative approaches, by vaccination, and gives you the trade-off of pros and cons. So it's just up here, not to go through in detail now, but if you want to go and get more information, then that's the place I would refer you to. And then just a little bit of an update on the kind of the cutting edge of this. We conducted a study a few years ago with the collaboration of Innovis, looking at the potential for genetic resistance to mydevisna. And there's some really interesting studies that we've produced in the UK, but also from Germany with similar mydavisna populations, suggesting that actually that mutations in a particular gene can confer some degree of resistance or ability to clear that infection. What we're interested in now is actually gathering as much data as we possibly can to see what does that actually mean. Is that associated with any production traits? Is that associated with animals never becoming infected, or are they able to tolerate the infection but not spread it? There's a lot of questions associated with that. But if we can find a genetic selection tool to deal with the disease, I think that's got a huge amount of potential mileage within the industry when we don't have other control mechanisms available to us, like vaccination. And the second article I list here is the one I mentioned from the more done, thinking about looking at different management control approaches to trying to eradicate it by reducing transmission opportunities. So I see time is getting on. Rush through the remaining slides before everyone gets too overwhelmed. Not much to say about OPA really, because compared to Johne's and compared to mydavisna, actually we have a real paucity of tools available to us. So we don't have any reliable tests in the live animal, any reliable lab tests. We only have definitive diagnosis by post-mortem to find the tumours involved. If you've got animals with symptoms, animals who are sick, animals who have got breathing difficulties, animals who are losing weight, then scanning lungs can be quite a useful diagnostic aid for those animals. But for animals who are not showing any symptoms, it's just not accurate enough, either in terms of sensitivity or specificity, to be a feasible option, because you'll miss too many really infected ones and you'll condemn too many perfectly healthy animals, as we've shown in previous studies. So here we've got a disease which at the moment we just don't have the tools we need in order to be able to control it. It's very similar to mydavisna in terms of its kind of viral nature. It's related to mydavisna, but it does have some interesting differences, particularly in the sense we don't see it populating an entire flock, spreading through an entire flock in the same way as we do with mydavisna. So from that point of view, mydavisna I would consider as a much greater threat than OPA in terms of production losses. And OPA can be very frustrating when animals drop dead very suddenly, typically because these lesions then precipitate a Pasteurella episode. But it doesn't seem to be associated with the same level of production impact that we see with mydavisna. So it's not quite on that same tier. I would have it as mydavisna or Johne's. If we move on then to the last of those viral diseases, which again is in that kind of top tier of important viral diseases that can cause really devastating disease in a naive flock, and also a really common disease, it's border disease. So for anyone who's got cattle, again, border disease is incredibly similar to BVD in terms of its epidemiology, in terms of the way it operates. So you've got this ability for the virus to hide in what we call persistently infected rams and ewes, and not be obvious. Its impact when it comes into a flock is that it'll spread through the flock fairly rapidly, not very rapidly, but fairly rapidly. If that happens during tupping, you're going to have lots of animals who have an elevated temperature, an increased temperature, and that does not go well with maintaining your pregnancy. So you get high levels of empty ewes who recover fine and would subsequently get in lamb if given enough time, but with only giving them 2 or 3 cycles, they've missed their opportunity. So what we see in flocks who have border disease entering them for the first time and they're naive, the first thing we see is a very high empty rate, a very disappointing scanning, and then subsequently we see abortions, miscarriages, stillbirths, and a small number of what we call hairy shaker lambs. So we're at a situation where we've got 30 to 40% of flocks infected, and that means you've got 60 to 70% of flocks potentially vulnerable to infection. So for Innovis, all the time I've been working with Innovis, I've always said this is one of the most important challenges to get on top of, because if a ram was to go into a flock with where it brought boar disease into a flock, it could cause a disaster very, very quickly. In exactly the same way, if you go and buy female replacements and they carry boar disease into your flock, that's going to be a disaster. It's actually more likely to happen with ewe lambs or with purchased female replacements, simply because you're buying more of them. So there's a greater likelihood of introducing it that way. But the risk for rams is quite high, which is why all Innovis rams are screened for the presence of virus before sale. So they all come with a certificate saying that they've tested negative for virus, and we do that as a routine to make sure that nothing slips through the net. And that would be something that, if you are having rams MOT'd before they go in, I would definitely check for, because of all of the issues, this is the thing which would bite hard and bite early in terms of flock disease breakdowns. Okay, and just to finish off, last disease, I'm sure everyone's quite depressed enough, but on a topical note, Bluetongue obviously has been a major concern last year. It's likely to be a major concern this year as well. The map we've got here is the latest map available from the government website on number of cases over the last 2 years. And you can see that spread of cases is always going to be an underestimate, because not all cases will be either noticed or reported. But it is working its way steadily across the country into the west, into the sheep dense areas. The pattern that we've seen in the UK doesn't seem to be quite the same as we've seen in Netherlands and Germany in the previous year, when we saw very high levels of mortality being reported. So there's a number of questions there. There's a number of moving parts there that could explain that difference. And we don't really know. So we don't really know what the underlying reasons for that is. So it would be a bit of speculation. But the important thing is really for individual flocks is to think about, okay, what are you going to do? We have got the huge benefit of having 3 vaccines available to use, which can act as an insurance policy. Now, they come at a cost, though, and for a number of flocks, a large number of flocks last year, it becomes a cost-benefit decision. Do we go in and we vaccinate with something that only lasts a year and will need to be repeated every year, or do we hold off? And that decision really came down to where you were in the country to a large extent. And I was having these discussions and this kind of cost benefit discussion with all of the flocks that I deal with. And I think it doesn't really help to be too dogmatic about it. And you'd certainly have some people within the industry being dogmatic in one way or the other. But I think we have to make, with all the decisions we make about animal health, flock health, we have to make a cost benefit decision, because we don't have an unlimited budget to spend. I think what was a very clear decision to make really was, you can consider a vaccination insurance policy type approach as being most likely to be beneficial for your highest value animals. So Innovis made the decision very early to vaccinate all of the rams, no matter where they were, and that meant that they had a uniformity across all of the rams, and that meant that if the worst happened, which thankfully it didn't in the end for most people, but if the worst happened, then the rams would be protected no matter where they went in the country. And we'll probably have similar discussions this coming year, depending on how the Bluetongue situation looks as it develops over the next few months, with a prediction for what it's going to be like. I'm not privy to all of that data. That's going to be coming out of APHA and DEFRA in due course. But as soon as that comes through, then I think there's going to be lots of sources of advice for how we should deal with it. But at least we do have some tools available to deal with it in the coming year. Right, that is a very brief, quite speedy run through, and can't cover everything in as much detail as I would like, but very happy to answer any questions that you've got, either now or send me an email at some later point, and we can discuss things in more detail.
Because I think there's a huge amount of information there, which it probably reflects in the fact that I think everybody is stunned with all the information. So, um, but we do have a few questions in there, which we'll probably just try and run through for the next 5, 10 minutes. And please, if people have got things they're not sure about, please put them in the Q&A and we'll pick them up. Um, just coming back to the cod, Piers. I suppose somebody was asking, what's the telltale sign of cod? And I'm right in saying, aren't I? It's that very typical 1 foot being held up compared to 2 foot trot.
Yes, it is really. So it's, I mean, the pictures I had there were of one ewe holding her leg up, and that's a really characteristic sign. So typically, not in every case, but very typically, you'll just get one very badly affected foot on a sheep. Very different to what you might expect to see with a bad foot rot case, where you'll get multiple feet with either foot rot or scald simultaneously. But with cod, it'll be one foot really badly affected and breaking out with a nasty raw lesion at the top of the foot where the hard horn joins the hairy skin. Very different to obviously what would be quite familiar with in terms of foot rot, with it being that starting off as a slimy scald or strip between the toes and then working from inside down the side of the horn that way. With cod, it's starting off with a swelling of the foot, hair loss, and then it breaking out in this red, raw, aggressive, often pussy lesion at the top of the foot, and then working its way down the toe, eventually that whole toe capsule coming away. And the animal is then very severely lame, what we call 10/10ths lame, so hopping lame. And eventually that horn will regrow from the coronary band down, but it's lost all its structure. It's lost the nice laminae on which the hoof should grow. So it grows this club foot as it grows back, which is never normal, and they're normally got some residual lameness after that point, and that's a very long time course for that to happen.
And
So yeah,
Piers, obviously, the few we've had, and we do get them like everybody, we've obviously used quite a lot of painkillers in terms of making sure these animals eat. And where does that fit into all of this, really? Sort of trying to keep animals pain free as they recover?
Yeah, absolutely. So, I mean, there's two parts to it really. There's what can happen to that animal. I mean, the vast majority of cases with cod, unless they're caught unbelievably early, they would be leaving the flock once they're recovered. But to get them to recover, it's a combination of an antibiotic which is effective within your flock, and there's a lot of variability there as to what antibiotics remain effective against cod. And because it's so painful, with any of the more than mildly severe diseases, then I would strongly recommend pain relief. And we've got a number of products available. Almost always in sheep, we will use meloxicam of lots of different brand names out there because that lasts the longest. So it's the easiest to give and very effective in sheep. So most of the sheep industry would use that. And I think we are getting a better appreciation within the industry and amongst sheep vets, that prescribing pain relief for not just cod, but for lots of painful conditions is a benefit in and of itself, even if you can or can't directly measure the effect. So we would expect them to eat better. We'd expect them to recover faster and have better productivity outcomes. But just on the welfare grounds, anyway, it's a good thing to do. I would say,
Yeah.
and that's true for cod and lots of other things as well.
Yeah, no, absolutely. And Piers, you mentioned, the some of the genetic resistance work. We have relaunched our what used to be Scrapie genotyping service here, and as part of that new genotyping service, people can now get the Mydivisner markers as part of that you've developed, or Nottingham have since. So that's one just for people to bear in mind, I suppose, with it all. So I think I've got a comment here saying that I think is picking up on the fact that you flippantly said that everybody will be depressed, but I think people are finding that taking such a proactive approach like this is actually quite encouraging. And from an industry point of view, it's quite nice that people are talking about it and are willing to discuss it. So, and there are solutions to all of this. I suppose the one we've learned of the years working with you for many, many years now is to be pragmatic and sensible with it. And actually, everybody tend to think that there is a black and white, don't they, in terms of a yes, no answer. But with testing and disease, it's quite different, Piers, isn't it?
It really is, and yeah, I've absolutely seen that change in the industry. I mean, so I've been a vet for nearly 20 years now, and when I first qualified, it was really a sort of buyer beware attitude. Very much, there was a lot of people looking for sort of plausible deniability and not wanting to address these issues at all in a way which is very short-sighted and short-term. And I think over the last particularly over the last 10 years, I would say, I think that there's a real change in the attitude of the industry and people appreciating that, once you've got the big things, under control, you really need to start looking for those marginal gains. And animal health comes into two categories, really: trying to avoid the catastrophic disaster, which is huge, and then trying to eke out the marginal gains from things which are more insidious and have been ignored. But those marginal gains do summate, do add up to quite substantial differences in levels of production and profitability. So people are catching on to this, and I think then it becomes a bit of a snowball effect, and the people who aren't engaging with it are left behind and are shown up for being not engaged. But as you said as well, Dewi, I mean, there is a danger with people wanting it to be very black and white and simple, and then getting almost a bit annoyed when it's not, when the world isn't the way they would like it to be. And one of the most egregious examples of that would be people saying, well, if you're vaccinating for a disease, you're just papering over the cracks. As though every disease can be eradicated if you only try hard enough. And that really, and I've had that attitude from really from a range of people, including some people in my own profession who maybe should know better. And that simply belies the fact that that's not the biological reality for a lot of these diseases. Eradication either isn't possible because there's a big environmental reservoir, and it's ubiquitous already, or we simply don't have the testing tools available to allow us to do that. So I think people have to be realistic and have to really understand what's going on and what the limitations are of the testing that we can do, of the vaccinations that we can give, and appreciate that they all have their limitations. As with anything, if something sounds too good to be true, it probably isn't true. So I think you'd have to take that as a scenario that you can encounter with animal health as well. When you get test results back which say something, you've got to really interrogate what does that really mean. Sure. And that takes a bit of effort. It takes a bit of experience. It takes a bit of research, and it takes everyone asking the right questions. It takes the owners asking the right questions, the vet. It takes the vet asking the right questions of the laboratory where they get the test done. And sometimes it takes the laboratory asking some questions of the test manufacturers who they buy the test kits from to ask the right questions. And unfortunately, there is a level of naivety at all of those stages, which we need to overcome, which I can spout on about from my ivory tower as an academic. But I've also got a foot in the camp as a sort of clinical practicing vet and as a sheep farmer as well. So I can sort of see it from those different sides.
And Piers, I'm right in saying, aren't I, that really, if you're going to source life, obviously closed flocks is the best scenario with proper biosecure boundaries and no sharing of stuff. But if you are having to buy stock in, the mart is not the place, not that there's anything wrong at all with mart, but really you need to do your homework with that source flock well before the day of purchase, don't you? Be it directly from them, or even if they are going through a mart. Iceberg diseases effectively manifest at those farms, and you're going to bring them in, aren't you? So
yeah, absolutely, absolutely. So I mean, marts have a really useful function, don't they, in terms of establishing price, establishing the right price, but they bring with that the huge risk of disease transmission. So I think trying to do things ahead of time is really useful. So from the catalogue, working out who you're interested in and seeing what they're prepared to share in terms of their health status. So I would definitely engage with that. And even if those sellers currently don't have that information, the more customers or potential customers they have who inquire, the greater the motivation for those sellers is to then actually establish what that status is and to then be able to share it.
sure.
So this is a slow process, and it is pressure from the buyers which is going to be the most powerful. There's a limited amount of effective pressure that can come from top down, as it were. The most useful pressure is from us as buyers.
And Piers, you're a big advocate of actually post-morteming sheep in a very focused, targeted way, and actually gaining, really valuable evidence from sheep that die, which is always a good thing because something dying is never a good outcome. But you've worked with, I know, our breeding partners, and with them Strugnal, and really using fallen stock as a really useful tool to help with diagnosis.
I mean, it's a fantastic tool. It's an absolutely fantastic tool, and fallen stock is never a good thing, but it doesn't need to be a complete waste. If you can get useful information from that post-mortem, that is not a waste at all. And when I say useful information, it doesn't necessarily mean finding definitively what's killed that animal. Useful information is ruling out that there is no evidence of X, Y, and Z disease. Maybe the clearest example of that would actually be with OPA. OPA, a disease where we've got no realistic tools available for flock level screening. The best we can do actually is for closed flocks who are selling animals to routinely screen all fallen stock. Because if you have OPA, it will kill some sheep on that farm. If you're screening every animal that dies and cutting up every animal that dies and looking for evidence of those very characteristic lung lesions, if over the course of several years you find none, and you do it honestly and comprehensively, that is by far the best way of establishing that you don't have the disease.
Yeah.
So that's just one disease example, but never waste a dead sheep. It is a bit gruesome, and perfectly understandably, some people don't want to cut up dead sheep, and that is a problem. But if it's something that you're prepared to do and you just need some help to gain the experience and the confidence to do it, this is something that quite a lot of us do training sessions on, do workshops on. There's lots of other vets in different parts of the country I can recommend as well, who are more than happy to do this for groups of farmers, because we all see the benefit of doing this. Obviously, you can do it through the APHA for absolute gold standard approach, or in Scotland through SIUC. And that is gold standard because they will do all of the ancillary testing for the same price. But it's not always possible on a Friday night or a bank holiday weekend to get that done. And you don't want to waste those animals. So having the confidence to do it yourself, then be able to take some photos, work with your vet, take some samples, that's hugely valuable. That's probably the subject of another webinar, really, but you can get a vast amount of information from that.
Yeah. And maybe that's one we can do in next winter's, or whenever it is, a session on post-morteming with you and Ben possibly. So, yeah. And I think that has to be the quote of the evening, Piers, just before lambing starts with people: never waste a dead animal. We're not suggesting people eat them, but we're suggesting that people screen and test and actually get value from those. So we're just turning 9 o'clock, so we've had a wealth of information. I'm sure people that are on the session and those that will listen to it as they get the recording, and the people that are on tonight will also get the recording. So if you've missed something, don't worry. You can listen to it again. And again, Piers, I just want to thank you for, as always, being the pragmatic, thoughtful, and very informed individual in terms of, we're very lucky to have you work with us. And that brings us to the end of these winter webinars. Thanks to Laurie in the background for making it all happen. She is there somewhere. But we wish everybody, I suppose, a very good lambing, because some of you are already in it. Some might have even finished, but the vast majority will just be a few weeks away. So yeah, hopefully these are a useful resource for people to look at. And we will wish you all the very best of luck in the next few weeks, months, and we will probably come out the other side in the various NSA sheep events, hopefully with sunshine, and we will see you on those circuits later on. So thank you very much, Piers, and thank you all for being on board with us, and very happy lambing to everybody. Nostar. Good night.